Yedemo boy remu ewo Accra High Court straight to a year Gifty Oware's NSS scandal. And assembly SC ewo Accra High Court and ya project a day at 2 year screen no and chain a day Amama High Court dismisses Gifty Oware's application seeking to halt the case until the determination of her appeal against the order to list her witness during case management conference. Abusuya Mami a friend no Gifty Mensa Gifty Oware Mensa and the NSS scandal no still no she's facing trials emu ayedin ede amani na one ne lawyers ekokopie mo court almost seeking for applications enka yen hote court proceedings no na Oshe Gifty Oware Mensa baby and the case no akwakodru no emu ayedin ede amana na an application on ne lawyers no file ekokopie mo ewo high court almost seeking for a year halting of court proceedings no abusuya eno na high court abo ede atwagua enye asam keto akrontin sisi a Gifty Oware emu ayeden ede amana enye asam keto akra yense momre wa hase no momi anko na yenkonko tie ensma ekoso ewo court ho unsubscribe ya subscribe na hit on a notification bell so na be any update be drop no wonsa ebetumi akabi aha gossip politics tv so medamase.
Former Deputy Director of the National Service Authority, Gifty Oware Mensa, seeking to halt the case until determination of her appeal against the order to list the names and addresses of her witnesses during case management conference. Her lawyers had filed an application to stay proceedings pending the hearings of the appeal at the Court of Appeal. Addo Asari reports.
Gifty Oware Mensa has been charged with multiple offences including using public office for profit, causing financial loss to the state, and money laundering. She has pleaded not guilty and is on bail. Following the dismissal of the application on Tuesday, March 24, defense lawyers represented by Nana Benye Akon holding the brief of Gary Nemakon informed the court of another notice of stay of proceedings pending the hearing and determination at the Court of Appeal. The appeal challenges the order of the High Court refusing to refer the case to the Supreme Court for interpretation. Gifty Oware's lawyers had argued that the practice direction on disclosures at case management stage, which compelled the accused to file witnesses, was in contravention with the 1992 Constitution. They therefore requested the case to be referred to the Supreme Court for interpretation and subsequently filed an application to hold the hearing of the case at the High Court. Presiding Judge Audrey Kokuvute ordered the defense lawyers to serve the prosecution with their supplementary affidavits and adjourn the case to April 15. Prosecution had notified the court that, despite being served with a notice of application to stay proceedings pending appeal, they had not been served with the supplementary affidavits after filing an affidavit to oppose the application. Lord Addo Asari, TV3 News, Accra.
And now the founder of UT Group and Amwabing Leadership Foundation, Captain Retired Prince Kofi Amwabing, has expressed concern about the judiciary, which he says could derail government's anti-corruption efforts through the Operation Recover or Loot. Prince Kofi Amwabing argued that highly resourceful corruption suspects are employing powerful lawyers to ensure indefinite delays of their cases. He spoke to Alfred Okense in an exclusive interview.
With these issues you raised with the judiciary and with the current Operation Recover or Loot objective that this administration is on, a number of people are standing trial. Do you have any hope and confidence in this oral?
No.
You don't have any hope in oral?
The oral. They said they were going to recover $21 billion or some huge amount like that. We all had hope in it. Maybe 1 year or 10 months down the line, how much have we collected? How transparent is it? Because when people have those kind of monies, they can manipulate the system. They can pay judges to let me put it to the raw. Because we are not paying our judges well. And they are going to go on pension. And what are they going to eat? How are they going to die? So really, if somebody has 1 billion CDs and you even process and take him to court, the guy can pay and get out of it. I'm telling you, it's a fact. You know, I'm not saying all judges are corrupt, but I mean, when you do not actually remunerate your judges well and they have to live a certain lifestyle and you have such huge cases that they have to decide, really, I mean, you are just being an ostrich, putting your head in the sand and saying that you are covered. You are not covered. We have too many of these issues. You know, Overall, 21 point something billion. How much have we collected? Not even 1 billion. And the people are working free and putting the money anywhere, doing whatever they can with it. And me and you sit here and we only listen to the news. And they are not transparent about it. I mean, this should be something that they are reporting on case by case and what
The Attorney General comes out every now and then.
But the Attorney General is overwhelmed by case. That's why my case has not been heard. I'm sure he hasn't even read my case, recent submission that we made.
In more news tonight, today is World Tuberculosis Day, and more than half of tuberculosis patients in Ghana are going undiagnosed, and the consequences could be deadly. Estimates suggest that while 44,000 new TB cases occur in the country every year, only between 22,000 and 24,000 are ever detected. Health officials are calling it a silent crisis. Deborah Abamensa has filed this report.
Ghana's battle against tuberculosis is far from over. According to the health authorities, the gap between actual cases and diagnosed ones remains alarming, with over 50% of those living with the disease walking through communities undetected. Experts point to resource challenges as a key driver of this diagnostic gap. Bernard Ziem is the program manager, National Tuberculosis Program.
It is estimated that every year 44,000 new TB cases occur in Ghana. As we speak, the National TB Control Program is able to detect and report on 20,612 TB cases. And this is because of the resources and capacities we have currently.
Beyond the numbers, the disease carries a heavy social burden. For many survivors, the battle does not end with treatment. Stigma follows.
A teacher looked through my report and saw chronic disease stated in the report. He asked, and I said tuberculosis. That is when he said, not here. People stopped buying from my mother. Whispers and accusation followed. People claimed I had HIV. Others said I was cursed. Friends rejected me, even some health workers. After completing the grueling treatment, I thought the nightmare was over. But in 2019, when I tried to enter SHS with a medical report, they rejected me again.
The government says it is taking concrete steps to close the detection gap. Authorities have procured equipment worth 30 million Ghana cedis as part of efforts to strengthen the country's diagnostic capacity. Professor Grace Ayensu Dankwa is Deputy Minister for Health.
As part of the efforts to strengthen TB detection and diagnosis, government has invested in the procurement of 10 new AI-enabled digital X-ray systems, 15 new Gen Expert machines, together with the accessories to complement the existing diagnostic infrastructure across the country.
World Health Organization country representative for Ghana, Dr. Fiona Braka, says equipment alone will not win the fight.
Too often, families are devastated with financial consequences. Nearly 70% of households affected by TB experience catastrophic costs, with the African region accounting for the highest proportion. These challenges are compounded by insufficient investment. The African region needs $4.5 billion annually to mount a comprehensive TB response. Yet current funding remains far below this level, with a gap of $3.6 billion.
Sustained investment, public education, and an end to stigma are equally critical if Ghana is to meet global standards in the battle against tuberculosis.
And still on health, the Ghana Medical Association says a viral video from the Kolebu Teaching Hospital, the emergency center, is real. Despite claims it could be AI generated, the association is urging the Ministry of Health to take a broader approach to fix congestion and improve care. The Ghana Medical Association has made some proposals on addressing the issues, and we're going to go through them on our screens very shortly. They're talking about overcrowding as first. Overcrowding at the Kolebu Teaching Hospital Accident and Emergency Center. GMA proposals institute a digitized intra-hospital bed management system and surge plan. This means that hospitals should be able to track in real time which beds are available, which beds are occupied or being prepared, so patients are not left waiting endlessly at the emergency unit. Secondly, they're mentioning timely clinical decision-making and onward transfer of patients from the A&E center to appropriate departments for definitive care, and doctors must be able to quickly assess patients and move them from accident and emergency centers to the appropriate wards for definitive care, reducing the dangers of backlogs at the emergency point. The third point they are raising is the association wants government to retool nearby hospitals, and this means that facilities around Accra should be upgraded with equipment and staff so that they can handle more cases, and that will ease the pressure on the Kolebu Teaching Hospital, which currently serves as a referral hub for much of the country. Another point they are raising is that establish a back referral system for patients, and patients who are stable after initial treatment at the Kolebu Teaching Hospital, they should be transferred back to district or regional hospitals closer to their homes to continue care, and this will in turn free up space for critical cases. The fifth point is that implement digitized real-time tracking of emergency room beds in the country. This would allow ambulances and referring hospitals to know exactly where space is available before moving patients, avoiding unnecessary delays and then overcrowding. They also are suggesting that coordinate pre-arrival communication between referral facilities, ambulance service and the Kolebu Teaching Hospital. So these are some of the things they are raising. Also, establish a national dashboard tracking emergency command center. They are pushing for the creation of this command center that would monitor hospital capacity nationwide. It will also coordinate patient distribution and respond quickly during crisis.
And away from the health sector, as Ghana battles a tomato shortage, local farmers are urging government to invest in improved climate-resilient seeds to enable year-round production. They argue that with the right support, irrigation schemes like Tuba can reduce reliance on imports and stabilize supply.
Ghana is currently experiencing a shortage in the supply of tomatoes following the ban on exports by its northern neighbor, Burkina Faso. But as government moves to reopen talks with its Sahelian counterparts for possible sourcing, some local farmers say the solution lies at home. They are calling for more pragmatic interventions rather than relying on imports, which continue to exert pressure on the local currency. The Tuba irrigation farm, which sits on 520 acres in Accra, could play a vital role in addressing the tomato shortage if the government adequately supports farmers. With an improved mechanized system, water is drawn from the Wager Dam about 7.5 kilometers away into a reservoir in Tuba for onward distribution, enabling all year-round commercial farming. Despite this intervention, tomato cultivation is largely done during the rainy season, spanning June, July and August. This is because the seed varieties currently cultivated cannot withstand prevailing climatic conditions. Farmers say they are ready to expand production if government provides the needed support. Abdul Karim Tete is a former assemblyman for Tuba and one of the 344 irrigation farmers tilling the land.
If you go to the north, there are arable land, vast land there that the government can do this irrigation system there. We cannot depend on other countries like Burkina Faso and then our neighboring country that we are importing tomatoes. So if our scientists can stand and do well and bring out those seeds, we have no problem.
His colleague Oware corroborates this, highlighting the need for improved agronomic practices.
Last year, this government gave us fertilizer and it helps. They give us 4,500 bags of fertilizer free, and we use it and the yield go up. So if this year they can give us some, in addition with some small things, we are going to produce tomatoes more than what we did last year.
A principal research scientist and tomato breeder at the CSIR Crops Research Institute, Dr. Michael Kwabnaotel says the challenges with local tomato production go beyond seeds. According to him, improved varieties of tomato seeds, including CSIR Kwabna, have been developed locally to match those from Burkina Faso, but more support is needed.
what I want to say is that we don't have one variety that can actually do well in all the season. Remember, in Ghana, we have major season where we experience heavy rainfall, minor season, and then the dry season. And so in breeding, we have something we call gene-by-age, genotype by environment interaction. Certain seed of variety that will do well in, say, Volta region may not do well in Ashanti or the Upper East. And so we say there's some interaction there, okay? So varieties perform differently at different environments. And so for us researchers, any variety we come out with, we evaluate them over seasons to be sure that this particular variety will do well at this particular place.
Dr. Michael Kwabnose is calling on the government to prioritize crop research.
For any forward-thinking country, they will not underplay the role of research. Research can turn this country into the positive direction.
For stakeholders, sustained investment in research, improved seeds, and farmer support will be key to building a resilient, self-sufficient tomato industry in Ghana. Stanley Nibleu, TV3 News, Accra.
Meanwhile, at the bustling Techiman market in the Bono East region, correspondent Belinda Teta reports of tomato price hikes following the Burkina Faso export ban.
The atmosphere at the Techiman market on Monday, March 24, was one of frustration rather than the usual vibrant commerce. The sharp increase in the price of tomatoes has left consumers in a state of distress.
I
wanted to buy tomatoes, but the price is high, so now my only option is tin tomatoes. Today, the prices of tomatoes go high. The one we usually used to buy for 10 cedis is 20 cedis, and my budget is not up to it. The high cost of entry to secure stock, coupled with lower sales, has thinned profit margins to a breaking point.
Ending of this month.
The date scheduled for the ban is supposed to be the end of this month. So because of that, there's a lot of pressure on the tomatoes. And due to that, they've also increased the price. And since the price is too high, we are unable to make profits.
Okay, abusuya winning and some ekoso or political highway. So Gifty Oware mensa in the court issues no bina just say ya drop at the mama and ye asam keto akora beda mase some more jepene kokotisa in some way at my gossip politics TV. So and don't forget to click on the notification bell send any updates be a dropping one so once every to me akabi beda mase.